Halo semuanya, saya Ira. Hari ini saya bersama Dr Jay Lim. Dia adalah seorang urologis dari PanAsia Surgey di Singapura. Dr Jay Lim adalah seorang urologis yang sangat ahli untuk masalah batu ginjal. Hi Dr Jay.
Hi.
Dr Jay, today I want to ask you about the myth surrounding kidney stone. Yeah, because I know that the kidney stone is actually made of calcium deposit.
Is it correct?
Yeah.
Well, there are a few types of kidney stones. And for example, there are the calcium phosphate and the calcium oxalate. And then there are the struvite stones. So when it comes to what stones are made out for, there are quite a few of them. But the majority of the stones globally all over the world, around 75% is actually calcium oxalate stone. That's around the majority of the stones we see, like I said, around 75%. But then the next most common stone is around 10%, which is uric acid stone. That's from gout sufferers. Then we have the lesser kind of stones, the more rare one, calcium phosphate, and the struvite stones, and so on and so forth. So yes, you are right. The most common kind of stones generally do contain calcium.
But people advise that we should take calcium for our bones. Is it the same kind of calcium that is deposited in our kidney?
Yes, I get that question a lot and think that's actually a very wonderful question that you're asking. So around 20 or 30 years ago, when we realized that the majority of the stones that we are seeing is calcium and oxalate, then there was a lot of research ongoing about the intake of calcium and the reduction of intake of oxalate. So the olden days, it was very common to actually hear doctors say that you need to control or you need to reduce the amount of calcium that you take. Now, it's actually been since proven that the benefits of calcium that gives to the body is much, much more than the stones that it can cause. So for example, calcium is very important in bone formation, that one we all know that. It's very important in muscle, and it's actually very important for the heart rhythm. Therefore, calcium is actually much more required and is actually better for the body. So the teaching now has then shifted from actually reducing calcium to actually not taking an excessive amount of calcium in our daily dietary intake.
So what is considered excessive then?
So if you were to take a normal balanced diet meal, there will be some form of calcium. Calcium actually occurs even in vegetables as well. So if you were to take food that has a lot of green leafy vegetables, that will contain some form of calcium. Of course, if you were to take things like cheese, you want to take things like milk, and you take yogurt, these things contain more than the usual calcium. The worry of taking excessive calcium usually comes from supplements that you take. Now, a lot of people take a lot of calcium supplements, usually vitamin D, and that's basically very important because we actually encourage ladies to take a lot more calcium, especially if you're after menopausal. And to that end, usually that the supplements that comes out in the forms that we all are familiar with are 600 milligrams tablet of vitamin D. If you were to stick to the recommended dose of 2 tablets a day, which is no more than 1.2 grams, generally that is going to be quite safe. If you were to ask me, the bigger problem is actually not from the calcium, it's actually the oxalate.
Oh.
Now the oxalate, or what we call it in Mandarin called 草酸, is basically a mineral that is very common in a lot of the food we take. If you were to have an excessive amount of oxalate, then the oxalate will then get from your gut stream into the bloodstream and deposit into the kidney, where they basically will then collect and deposit and get bigger and bigger over time. The oxalate usually comes through our diet through a fair few kind of food. For example, the common things are like strawberries contain a lot of oxalate, chocolate contains a lot of oxalate, spinach, which is a green leafy vegetable, contains a high level of oxalate, so does parsley. These vegetables are generally not the major source of the problem. The major source of the problem actually comes from a lot of the nuts we take. All kinds of nuts contains more than 100 milligrams of oxalate per serving, and we are looking at peanuts, macadamia nuts, pecans, and all kinds of nuts that you have generally contains a very, very high level of oxalate. Things like ikan bilis, small little fried fish that we eat, especially when we're watching TV at night, usually with alcohol. That's a situation whereby we take in a lot more oxalate than we are aware, because what happens is we snack and we snack and we snack. We eat a lot of oxalate, plus usually at late nights we take a lot of alcohol or beer. That actually dries out your body. You are dehydrated. Then you are packing in the oxalate, taking in a lot of oxalate. This is a situation whereby oxalate then gets deposited into the kidney, and as time goes by, the oxalate will wait for the calcium, and once the calcium meets up in a kidney, they form stones, and over years, this is how stones are generally formed.
I see. So the problem is more of the oxalate instead of the calcium themselves. So it is safe to take calcium supplement within moderation.
That is correct. So it is very, very hard to excessively take in calcium, but it's very, very easy to actually take too much oxalate.
Okay, the second myth is the kidney stone is only happen when you are older, because maybe lifestyle changes and everything. Is it true?
That is actually also not very true. The youngest patients that I have seen are in their teens, especially when you have a family history. The other thing is Singapore, Indonesia happens to be along a part of the world called the Stone Belt. The Stone Belt is an entire stretch along nearby the equator of the world that includes the northern part of Australia, Queensland, all the way down to the island of Java and even Sumatra, Southeast Asia, Malaysia, Indonesia, Vietnam, all the way to India, and even to the top part of North Africa, and into the middle part of the continent of North and South America. So it's actually a nice little belt.
Why do you call it a stone belt?
Because of a few things. Now, because of the weather, the fact that it's a bit more hot, and the fact that the water around this area might contain a lot of minerals. Mean to say we take a lot of well water, or we don't take a lot of processed fluid. Therefore, we tend to take in a lot more minerals than we have to. And the population of these countries generally forms a lot more stone. And no, it doesn't necessarily only occurs in older folks. The most common age that I see in Singapore are actually in the 30s and the 40s age group, primarily due to the fact that we live in a hot climate, plus the fact that we don't drink enough water. Dehydration is one of the most common causes of having stone formation as well in these countries too.
I see. Okay, so it can happen from teenager to whatever age it is.
Yes, so the most common age group would roughly be in around the 30s and the 40s, and in fact, these are the population whereby they are economically very active, they are working, they're contributing to society, and this is actually the segment of the population that actually suffers the most in terms of healthcare costs.